This conference will now be recorded.
I'm the operations lead for Africa Evidence Network. I will be chairing this session today, and I would just like to take this opportunity to welcome everyone to this webinar. It's titled Designing for Equity in Capacity Development in Africa, and Experience Sharing from Cameroon. So this is our second of 12 webinars to come as part of the series we have launched yesterday. So I'm sure you are enjoying Africa Evidence Week. Enjoy. The festivities will finish on Friday. Just continue to enjoy the festivities. Just to go through just a few housekeeping rules, we just want to invite everyone to participate. This session is a talk show session, which is facilitated by a moderator. Please participate. And then the session will be recorded, as you've seen at this point. Please keep your cameras off just to make sure that we save bandwidth, and also those that have slow connection can be able to be part of the session. Also, please keep your mic off unless you've been prompted by the facilitator or the moderator, so that it doesn't disrupt the session with the background noise that will be happening. If you are experiencing any technical challenges, please write on the chat to Precious, and then she'll try and assist you the best way that she can. And then lastly, please continuously engage on the chat box. If you have a question, you have a comment on our chat box, and Liqua will be managing that chat box, and they'll be feeding your inputs into the bigger session. Just to give you, I think, a small background in terms of these webinar series. It's a 12 webinar series. So we launched yesterday. This is our second session. So this is grounded from a manifesto that was developed for Evidence 2020 online in 2020. So this is basically a document that is available online on the AEN website. Please read it, and also we will showcase it on the 16th of September to reiterate for you so that you will understand what the document is about, because all these workshops are grounded from that manifesto, and we want to enhance it and build it. To share with you this series, the objectives of this series, we just want to share experiences and ideas that push our thinking on how we enhance capacities for evidence use in Africa. Secondly, we want to enhance the connections that can lead to collaboration among AEN members to strengthen evidence capacities. And also, we want these discussions to be the basis of us improving the manifesto, which is what I've indicated earlier on. So it's important for you just to read that manifesto and acquaint yourself with it so that you can follow these discussions that will be happening over the 12 webinars. I think now is the time to hand over to our moderator for today, which is Beryl Leach. So she's the one who's going to be facilitating all the discussions and ensuring that the conversations are engaging. Hand over to you, Beryl. Take over the session. Thank you.
Thanks, Ziwe, and welcome everyone. I'm very pleased to be here and to have the chance to be learning from my colleagues in Cameroon on such an important subject as how we can innovate and improve capacity development in evidence-informed decision-making in Africa so that it's based on African knowledge, African ways of working, African expertise in how we're doing it. I'd like to just orient where this discussion is going to be on equity by very quickly pointing out that in the manifesto, there's a specific principle that mentions equity. It's the only one that does, but it's an important one. And like things like gender equality and equity, it's the last principle, I think, or nearly the last one. And so there's a challenge for all of us to think about how to make sure that it goes across all of our thinking and becomes more than a bullet point. But the bullet point is essentially that we address ourselves to integrating and always considering power dynamics in what we do, what we design, how we analyze, how we do our research, how we appraise evidence, and enhance equity. And that emphasis is added, that there is in the principle that we are especially aware of youth, women, people with disabilities, rural populations, and other marginalized groups as central capacity pillars. And that means that those who are most marginalized, always due to a combination of marginalizing factors, not just ones. No, you're not marginalized just because you're young, maybe in your family, but overall not, and how to make sure that we look at all those factors, and that's central to our thinking. Equity is about thinking about those who are the most marginalized for whatever reason. So I just wanted to make sure that there was this link back to the manifesto and what we were going to be talking about. I'm going to introduce our participants, and they all work together. And so one of our goals of these seminars is to increase networking and sharing of experiences. And this is a little mini network that's going on. And we're going to have Patrick lead us off, because eBase has been driving how to innovate and work better and differently at the community level. And Clotilda and Evelyne will be able to give their perspectives on what's needed, how that's working, what needs to be done differently. So without further ado, I'm going to start with all the introductions so that I don't have to break the conversations as we go along to introduce people. The first person I'd like to introduce with pleasure is Clotilda, who is an educationist and works on gender equality and sexual and reproductive health and rights as an advocate, and she's a peace builder. She's the founder and CEO of the Center for Advocacy in Gender Equality and Action for Development. And she has had training in systematic review training, and that's one of her ways into understanding the importance of evidence-based decision-making. Her organization focuses on building capacities of women and girls for sustainable development. It's a community-based organization. She has specific experience in designing initiatives, implementing and evaluating for EIDM for social cohesion, menstrual hygiene management, and women's participation in leadership, decision-making, and peace processes. Welcome, Clotilda. We're pleased to have you. Evelyne Lum is Executive Director for Hope for Vulnerable Children's Association, and she is also the coordinator of Dignity Sisters program, which is working also in working with children. She has a passion for empowering adolescent girls and young women. Her Hope for Vulnerable Children Association is a child rights organization that uses research, education, advocacy, and community partnerships to enhance children's protection. The Sisters program works to fight for gender equality, and they are both working on HIV and women and girls. And the Sisters program also works on women's lands rights. So very strong gender base coming in from our partners. And last but not least, because he's going to lead in the short presentations, is Patrick Okwen, who's the lead at eBase, and he's also leading the efforts to develop innovative tools for EIDM, and ones that will work well at the community level, and also tools that work well with policymakers, which is often where we focus our attention. He's active in capacity building in the Lake Chad Basin for policymakers, practitioners, and citizens, where he uses innovative approaches to improve livelihoods, especially for underserved groups. He is also part of the team currently developing guidelines for reporting observational studies with an equity lens, which would actually be a great topic for a separate seminar if ACE colleagues are listening. Patrick is one of the evidence leader. He's a winner of the Africa Evidence Leadership Award in 2018. Congratulations. And he's also fluent in French and English and loves gardening. Topic for another seminar is gardening, especially for stress relief in pandemic times. And we are not going to be speaking in French in this session, but we look forward to a French language session later in the week. without further ado, I'm going to hand over to Patrick to give us a quick overview of how they're framing the capacity development work amongst this mini network in Cameroon.
Okay, thank you very much, Beryl, and hello everyone. I'm really excited to be on this webinar. Really happy that the network was able to select members of this mini network. So in essence, eBase has been leading building capacity in evidence-informed decision-making in the Central African region, the Lake Chad Basin in particular, Cameroon, Nigeria, Niger, and Chad. And the two organizations that are here with me today have been working with eBase at different levels. Since 2018, we've built capacity with the team at Cagiet, with Clotilda, to get more research evidence into the projects that they were rolling out for policy, for users, for girls' voices. However, Evelyne, with her organization at Ovuka, has also reached out to eBase, but it's been unable for us to find the funding and the time to reach out to them. And this all tells us that we have the capacity to actually build capacity within the region. However, there are still challenges for funding, and the demand is there because these organizations actually approached eBase to see if they could be helped with getting research evidence into their practice. So thank you.
Thanks, Patrick. We're going to come back to you for just a little bit more description as we go along about your methods, your individual methods. But right now, I'd like to hand over to Clotilda to give us a quick overview to get us started.
Okay, thank you very much.
Sorry, Clotilda. There's somebody. Can everybody check their mics? There's a background noise coming through. Precious, can you see? It sounds like a plane circling around, like a model airplane circling around someplace. Thanks, Precious, for checking that. Clotilda,
Okay, thank you very much for giving me this opportunity at your sake. I'm Clotilda, and CEO of the Center for Advocacy and Equality and Access to Development Project. I'm very happy to be part of this evidence fair, as I can say, evidence-informed decision-making fair, especially as far as equity is concerned in capacity development. We have been working at Cagiet. We work to improve the quality of life of women and girls in Cameroon, and we work in different program areas, including sexuality education, sexual reproductive health, advocacy, and women and girls leadership in peace building. We have been enhancing capacity for women and girls since 2018, and we have been working with eBase Africa and other organizations to network and make sure that in as much as we are building the capacities of women and girls, we are also building our capacity. We have been involved in designing several initiatives, including the enhancing capacity of adolescent girls within school media, with the aim of supporting the retention of girls in school by improving knowledge on sexual and reproductive health rights and promoting social cohesion. In our peace building program, we are also enhancing the capacity of women to take up leadership positions and engage in actively participating in peace processes and decision making in their communities. This is because we strongly believe that capacity building can enhance the decision making of women and girls in Africa because they are facing lots of problems and are a special vulnerability group. And when you build their capacity, they can be able to make informed decisions in the work that they do and in the advocacy that they carry out in order for their voices to be integrated. We are equally collaborating with other organizations, as I've said, with eBase, and one of these collaborations led to the strengthening of our organizations, where we benefited from a training from JBI on comprehensive systematic review, which was conducted by eBay Africa. And we were able to integrate this training into our capacity building design work, specifically menstrual hygiene management, sexual reproductive health advocacy within the school, where we're able to pull out some of the results. We actually did a qualitative research with eBay, although we did not finally synthesize everything to have it like established. We were able to use what we got from this qualitative research to start the way forward with the work that we are doing with the girls till now. This is because of the difficulties and challenges that we have continued to have in being able to continue to build this capacity. We take into consideration equity when we are developing capacity building by looking at the different packages. We try to develop different packages for different age groups and the different target populations that we are working with, including people living with disabilities. Our target population in the above projects that I've just named includes women, men, boys, and people living with disabilities, plus the policy makers that we are marking to work with. The decisions we take from these interventions are informed by baseline surveys, formative research, through key informant interviews, and focus group discussions. This informs us on the needs of different target populations, and we are able to carry out the interventions that we do. Our main way of implementing and designing our interventions are basically through workshops, school clubs, community clubs, where we break the big policies and big research evidence into digestible formats for young girls and women, peer educators, and ambassadors. So basically, we use women and young girls as either peer educators or ambassadors as they come out of this program to get to other people in the community. The above interventions may sound great, but there are still lots of challenges which may keep us actually away from getting to where we really want to get to as far as evidence-informed decision making is concerned. For instance, when I am working in a project, I'm working on a project now that has to do with women participating in peace building, raising community awareness and the use of Resolution 1325 for women to be able to effectively participate in peace building. I reflect on how to make these women use research evidence in the decision table. If they were to get to the decision table, how could they be able, or is it possible for them to use what Dr. Okwen just described as evidence theory to be able to get what they want, or to get everyone understand what they are saying? Can they use it as evidence? Can they use this to actually put their points through? This actually is depending on their level of acquiring this knowledge, and it comes back to the fact that there is need for more collaboration with organizations like eBay, and there is need for more means to be available so that we can actually continue to have this capacity building to a certain level. So by this I'm saying we have had some capacity building. There is still need for us to have more so that we can be able to actually perfect our work as far as evidence-informed decision making is concerned. Thank you.
Thanks, Clotilda. Just in case you don't know, that there's some background noise from your mic, and so Precious is going to work with you now to see if we can get that fixed. I think it has. You can mute now. Can you please mute now? Okay. And thank you. It may have affected some of the other participants' ability to understand absolutely everything that you said. I'll try to recap. I missed some things myself, but some takeaways included getting training and systematic reviews within your group so that it enhanced your capacity to be able to find evidence that you needed. One example was the menstrual hygiene program. What's the evidence on that? And that it seems that across the board, your interest and use of EIDM is to support your advocacy work when dealing with policymakers, and that you also have come to appreciate the need to have good evidence to advance your work. And so you're looking forward to continue to develop this long-term relationship within your network in Cameroon. To the extent that I've missed anything, please just let's hopefully get that mic fixed, and we have plenty of time. We'll just circle back to it as we can in the discussion. So let's move on to Evelyne and her short overview of what she's doing and the importance of capacity development in her work.
Okay, thank you very much, and thank everyone who is here to follow the discussions today. And I want to say that I'm very happy for the African Evidence Network team for giving me the opportunity to be able to express what we have been doing in this platform. I want to say that I'm particularly excited, not just because I'm here, but because when an invitation was sent to me, I saw my name under Designing for Equity. I was so excited because this is what has been running through my mind and my team within these last years, that people design these days and they don't put people first and equity. They just design because they want to achieve whatever objective that they set for themselves. They don't consider who benefits or not. So that's why I was particularly excited. So moving into what we have been doing, we have been working on HIV and AIDS with adolescent girls and young women. And we have been working in the other program with women on women's land rights. And all of this, we are building the capacities of the adolescent girls and women on how to know the problems that they are facing and how to, first of all, begin to tackling them. I'll first of all start with the program that we are doing for Hovoka. And want to say that this a capacity workshop is being triggered, or a capacity development is triggered by some other evidences. So the Global Fund and UNAIDS and other national bodies have discovered that, have evidence that adolescent girls and young women in Cameroon are highly affected by HIV and AIDS. And they are not only affected by HIV and AIDS, but there is also another evidence that the high rate of HIV is because there are other facilitators, there are other barriers. And one of the barriers that they identified was the policy itself, the policy on HIV and AIDS itself. The policy itself has a problem. So this is what triggered our capacity development for adolescent girls and young women. And also the fact that in Cameroon, there is evidence that 24 girls are infected with HIV against 9. So it was a particular, against 9 for boys. So it was a particular issue. And the Global Fund, through Vive Healthcare and Y+ have supported us to try to see how we can reduce this high rate of HIV for adolescent girls in Cameroon. So what we did was, looking at the policy, we had to build the capacities of adolescent girls and young women on how to analyze the policy, read the policy, understand it, analyze it, and see the gaps that are there that will be used for advocacy, for evidence-informed decision. So the methods that we're using was mentorship. We got a mentor that was mentoring them on how to read on how to analyze and how to develop advocacy messages that will be presented for the decision makers, so that changes can be made in the policy, so that there will be informed decisions based on this evidence that will enhance the national HIV policy, so that adolescent girls can be able to access services with ease. It was also about having because decision making is not only at the level of policy, it's also at the level of the receiver, it's also at the level of the victim. So we also wanted that adolescent girls and young women who are victims and who have been tagged as those that are being affected by HIV the highest should know what is happening to them and be able to take a decision whether they want to remain in this situation, whether they want to live free. So that is basically why we why we were building the capacities of adolescent girls and young women. In this process, we had to, in the process of designing, we had to have some considerations for equity. Now, our considerations for equity was like looking into the that we bring in adolescent girls and young women with disability, those who are living in the slums, those who are living in the rural communities, those who are illiterate, and above all, and we also look at the aspect of technology. So if we are bringing in girls, what is the method that we'll be sharing? Maybe these policies there for them to analyze. Are we going to be sharing on WhatsApp? Are we going to sharing on phone? Are all the girls having phones? All these things in order to make the training adaptable. And above all, we had to bring in the stakeholders so that they'll be able to help us to make a good design for the capacity development for adolescent girls and young women. We also had to make sure that the key populations, because the key populations are the kind of populations that are being stigmatized and discriminated upon by just normal people in the society. Who do I mean to be key populations? We are talking about the transgender, we are talking about women who have sex with women, we are talking about female sex workers, we are talking about women who inject drugs. And we know that in Cameroon specifically, I don't know, maybe in other countries, the law criminalizes these key populations. And these key populations, evidence has shown that they are amongst the groups that are spreading the HIV the most. So then we looked at if we don't bring them in, they'll continue to spread the HIV, because, for example, in Cameroon, female sex work is not legalized, but it is tolerated, meaning that it is going on and nothing is being done. So this group of persons are living amongst us. We have not yet created a world where we are going to leave them there. So we need to bring them in so that they'll be able to learn and identify those barriers that are also disturbing them from accessing these HIV services, so that they can also take informed decisions, so that they will also be able to take decisions for themselves. Because these sex workers, they have their partners, they have multiple partners who are spreading the disease, and these multiple partners, they are also husbands of other women who are not sex workers, and they are spreading the disease as well. So we have to consider them into the program, so that we be able to advocate for those barriers, for those discriminatory attitudes that are keeping them away from accessing HIV services. However, what I've just presented, it sounds very like we know a lot and we have been doing a lot, but this is we are just doing it at our own level. We designed a program at our own level, and based on the experiences that we got through a collaboration with Recrea, through a project that we implemented with Women 2030 on menstrual hygiene management. They were doing an evaluation for that project, and we were trained on how to go to the field and collect data. This is not enough, as we know that we have experts in Africa who can impact us in Africa with the right skills. with the right techniques, with the right methodologies. So luckily enough, we have eBase, who is not too far, that we have reached out to eBase for more capacity, because when I read the manifesto, they are talking about the African evidence ecosystem. This is so high above our level, and we could equally take our project, our capacity building much further, and do a research for advocacy much further, but because we are lacking in all those other steps, so we need proper training on how to enhance those other steps. So I think I will stop here for now. This is what we have been doing, and I'm sure that our listeners have taken what we have, and they have seen our loopholes, and then they will come to it. Thank you.
Thanks, Evelyne. That was fascinating, and there was a part of me that didn't want to stop you, but unfortunately we have limited time, and I think there's so much that we could be drawing out from that work. I would just like to highlight that you gave really good examples of the type of equity factors or inequity factors that you are considering, and a question that maybe we can loop back to is, what did you do in your group to decide on the range of factors and how you could, so for example, people living with disabilities, illiteracy, barriers to tech, things like that are marginalizing factors that are intersecting and with these populations of focus, so young women and girls. So that was just one question that I had that came up that perhaps we can get back to, but I'd like to go back to Patrick, and Patrick is going to skip ahead to slide 3, please, in the interest of time, and talk us through quickly 2 of the innovative tools that eBase has come up with that they are sharing with their colleagues in Cameroon, and even though he has identified already that there's a problem getting funding, and if there's time, Patrick, a good question for you is going to be, what's stopping funders from funding innovative capacity development in Africa? A very loaded and important question there. But please talk us through the evidence barometer that you have developed, and also this important method for storytelling, community level and local languages. So thank you very much. Over to you.
Okay, so thank you very much. So at eBase, we are improving livelihoods through innovation and best practices, especially for underserved populations. So if you could just move to the 3rd slide, we can talk. So we have trained over 75 evidence users every year since 2018, and this includes policymakers, practitioners, and citizens. And we have designed a number of innovative tools, and Beryl already mentioned some of them there. So one of them is the Evidence Barometer. And the Evidence Barometer is a tool which we use with policymakers to make sure that the evidence or the policies that they develop or the programs that they are developing are actually taking into consideration evidence from research, and or creating or highlighting the fact that there is no evidence to inform their policy or their programs. And it cuts across a number of points, including equity, stakeholder engagement, addressing conflict of interest, peer reviewing, rigor of their evaluation, how they integrate this into their systems, how resources are being distributed, and ethics issues. So why is this important? This is particularly important because there is need that every policy or every program that's rolled out by policymakers or governments is actually based on evidence. If we look at, even if it's, for example, vaccination against hepatitis B, should you start at birth or should you start at 6 weeks? And what are the implications for the money that you invest in this? So if we look at this from this perspective, then we'll understand why you could put money into a program vaccinating kids at 6 weeks for hepatitis B instead of at birth, and all the money you are actually putting in there is wasted because you did not use research evidence to inform your policy. And this is actually a policy that cuts across most of Africa. Most kids are vaccinated at 6 weeks of age. How does this work? So we work with policymakers. Either the policymakers come to us or we go to them if we see a program or a policy that we feel that we could come in to help. And we develop the PICO question with them, the population, the intervention, control if it's possible, and then outcomes that would be of interest. And then we walk through that with them to generate evidence and then to evaluate their policies within the evidence barometer. And then the evidence barometer automatically makes recommendation based on scores on these 8 points that I mentioned. And it would tell them that if you do this, you would score 6 or 7 extra points. And that helps them to know what exactly they can do to make sure that they get good value for their money invested. And the second concept that we are working on there, this should be on the next slide, please, Siziwe, not this slide, the next slide. So the next concept that we are looking at is something we call the Evidence Story Day, which is in a local language which is spoken across most of sub-Saharan Africa, which is the Pidgin. It simply means that let's talk about evidence. And the objective of this approach is to actually get research evidence to non-literate communities. So in most of Africa, especially rural communities, unlike in the north, most people cannot read or write. And so if you give them research evidence, even if it's in a very simple language, if it's in English or in French, they may not be able to understand. So we need to get this in a language that everyone will understand, which is their local languages. And what is even more interesting is that we need to identify culturally relevant approaches to get to communicate this information to the community members. And one of these culturally relevant approaches is storytelling. And we've been using storytelling for a long time, actually getting traditional storytellers to work with systematic reviewers at eBase to translate the complex research language into simple stories. In short, when you look at systematic reviews, they talk about effect sizes, confidence intervals, powers, heterogeneity, and this may mean absolutely nothing to most people, even those who can read and write. So what we do is that we convert all of this to very simple language, and we develop evidence statements that can be incorporated into stories that storytellers will now tell community members. So in essence, this is how it works. And we try to diagnose where that community is located in the trans-theoretical model. This is a model in behavioral change to see that, okay, is this community still in denial of the problem? Is this community contemplating change? Is this community preparing? And this is another thing that we can have for another webinar, but which is very interesting, which has actually could determine the success of a story that a storyteller is telling. So in a nutshell, this is about what we are looking at. And we do have some needs there, which are needs for publications, needs for networking, and then needs for funding. And as Beryl mentioned, we could come back to look at what are the challenges with funding if we have time. Thank you.
Thanks, Patrick. A quick question before we leave you on this. Fascinating approaches, and I look forward to learning more about them. And I know you've run some webinars already on some of these techniques. So perhaps if you put up in the chat some links so that people could maybe go to YouTube or wherever you store them and have a look, I think everyone would appreciate that. One quick question, and that is, so I got a very clear understanding of kind of how the method goes out to the community, right? But what's that step that grounds your storytelling focus on what the community has said it needs? So
Okay.
is it just quickly, is it a two-way street and we just didn't get to it?
Yes, it's a two-way street. And
Okay.
this actually is built from the African traditional style of storytelling. The African storyteller only tells their story to an audience that they know, and they attempt to communicate a particular moral lesson to their audience. So coincidentally, this also is what we have developed. We have actually worked with traditional storytellers to understand that. But we built this now on the trans-theoretical model of change, where we looked at where is the community located. So once we know where that community is located, if you take, for example, the use of condoms, a community may be in, let's take the COVID vaccine, for example. A community may be in denial or in pre-contemplation about whether to uptake the vaccine. If you don't tell them stories that speak to them at that level, they wouldn't understand. If, for example, you come to them and you are telling them a story which is meant for a community that is ready to take vaccines, your story will not make any sense. It wouldn't be relevant.
Okay, thanks for that clarification. I really appreciate that. I'd like to Precious, have we got an update? Clotilda, how's your mic doing? I'd like to come back to you and have you pick up on some of these techniques and how they're informing advocacy. I'm hearing the plane sound. It's not, yeah, it's pretty overwhelming.
The noise?
It's not, Clotilda, it's not possible for us to really understand you over the noise.
But unfortunately, there is no noise here. I don't know why. Maybe I'm using an earphone. Let me disconnect it and see if it gets better.
Okay.
Speak now. I think it's improved.
Yes. Okay. Can you ask the question again?
Ah, good. Welcome. It's much better now. So thanks so much. I would like you to react, if you can, to what we've heard so far in terms of how you're taking that on board at the center and using, say, storytelling techniques and innovating EIDM to develop the capacity of your association members and community members to use evidence to be empowered to make change that they want to see. Are there any key takeaways from your involvement so far of what's working or what you think still actually could benefit from further attention in developing the technique? You have to unmute, Clotilda.
Okay. Is that okay?
Perfect. Thank you.
Yeah. So, my experience in engaging grassroots women in peace building, especially because that is where we actually work with women. And the first thing is that the women are very, very interesting in the storytelling approach, because first of all, it takes into consideration their capabilities. Most of the women we are working with in the grassroots are not super educated to be able to break down these research evidences, and they are happy to understand that they're just telling their stories using the language that they can use every day can be used to actually communicate their concerns and peculiarities to policymakers. The only challenge we have here is that we still actually need to be well grounded on this particular tool with eBase, hoping we'll be able to have the means to do that. And even with adolescent girls, given their ages and interest, we have also found that using the storytelling approach is of great motivation to them, because the storytelling, as Patrick said, is already something like a cultural approach in our communities. Even when we grow up,
when we grew up, most of what we know today was passed on to us through storytelling. And now, and most often, it is now that when Patrick brought in this approach that I actually realized that there were times our parents needed to pass a certain information to us. They would tell a story so we can see the evidence that has been built in that. The only challenge, as I can say now, is that there is really need for this approach to be disseminated widely. So we still need a lot of capacity building on this so that we can actually perfect it and engage these communities. And as I said, it's also important because it considers their needs. It does not need any official settings. They don't need books. They don't need telephones. They don't need to even understand that what, like for instance, I'm talking about Resolution 1325, which we all know that is a big document that is a normative framework at the international level. They need to break it through the national action plan, and then to actually have the women at the grassroots level be able to use this to advocate for what they want, maybe at the municipal council level or at the level of their communities. Now, when it is turned into this evidence story and told as a story and like actually act it out, they actually understand it better and resonate with it. So what I can say now is just the need. There is the need for these kinds of approaches to be supported so that grassroots women organizations and other people who are working on evidence-informed decision-making can easily integrate it into their own activities. And like I was going to say, I had asked Patrick that, for instance, I've been reflecting more on the possibility of using these women to research evidence in decision making using a storytelling approach. This is something we are really looking forward to effectively develop with eBase if we have the means.
Thanks, Clotilda. I'd like to turn to Evelyne and ask her to pick up on that, but also to answer a question that comes up in methods conversations a lot around equity, which is how do we decide which equity determinants, which are the drivers of inequality and inequity, to focus on in our work, and how do we know when we've considered enough of them? So you had mentioned in the Global Fund work on HIV and targeting young women who had higher rates of infection, that you were very proactive in trying to identify what were the characteristics that were important to include in the population you were targeting. But if you could just take us through how you did that, because I think one of the things we want to focus on in our experience sharing is not just the what we're doing, but the how of what we're doing, and address that, and then your own thoughts on this thread that we have going about storytelling and how useful that has been or not in your policy advocacy work. Is that good enough evidence to go to policymakers to change national policy, to say, I have the voices of women and girls from the community, and based on that evidence, please change your policy? So those 2 points, if you could amplify on those, I'd appreciate it.
Okay, thank you, Beryl. I will begin from the last question, that how we going about the storytelling, how is helping us to. I want to say that when you have people tell their stories, it's different. So recently, as we were mentoring the girls, we also asked them what are their own barriers before going to find out from others. They have to look at their own barriers, because when you tell your story from your own standpoint, it is more clearer for people to understand what is going on. So these adolescent girls and young women were mentored, and they had to tell their story. I was even at the point where we asked them, to get more evidence to cap this concrete, it's good that some of them should go to close nearby hospitals and find out. For example, we're asking them, because when we read about the PrEP and PEP, that's pre-exposure and post-exposure prophylaxis, during the capacity development workshop, they didn't know about it. So we mentored them and asked them to go to nearby hospital and find out how it's working and find out whether it is really available. They brought back some amazing responses. They went to other hospitals. First of all, they complained about the reception. They complained about the way they received them. It looks like those at the reception did not master the departments in the hospital. And so they were like, okay, just go that way. They just point a direction and just go there. And because they wanted to make their stories more clearer, they had to take the pains to go through, and finally they got to the maternity section where they were finally referred to. And information they got is that, okay, yes, post-exposure prophylaxis are available. You can go there. By the time they were going there, the place was locked. In the other case, they told them that pre-exposure prophylaxis are existing, but now there is a lot of discrimination in it because they are only being, they have just a small quantity and it's only being given to sex workers. Besides, it was not really a problem because the policy in Cameroon has not yet make it clear that pre-exposure prophylaxis are being used in Cameroon. So they brought back this knowledge, and they had in the press conference that we had, and which we took that opportunity to invite some policymakers so that they'd be able to listen to them. They told the policymakers the stories from their own standpoint of view, and the policymakers, like for example, we're advocating, the policy says that HIV should be included in the curriculum of schools. So they also went out and they made this investigation and discovered that it is not being implemented in school. And so they told the stories from their own perspective and from their own experiences. And the delegate of education was quite excited, and it was like, they didn't even know about this aspect of policy that is existing, and they all asked for the presentations in order to get something to do. So, the other question was on how we decide on the category of persons with disability that we bring into our programs, or if I got it well. Did I get it well?
Yeah, the idea is that when we, what is an equity lens? Okay, so how do we decide how we're going to look at addressing inequities, right? So what causes marginalization and vulnerability? What discriminatory factors are there? And so you mentioned a list of those that you were considering in the HIV work that you were describing. And so my question was really, how did you decide which of those equity factors were going to be part of how you designed and targeted what you were doing, and not just for an intervention, but targeting the type of evidence that you were going to collect and from whom and why. So for example, in the previous discussion, Clotilda was saying that storytelling is important in terms of finding out what's important to the young women. Okay, so what are their barriers? So how did you decide to focus on rural, for example, or slums, or things like that? Did you go out and find out about it from within the community, or did you decide as part of designing with the Global Fund or within the proposal? I could be totally wrong. I'm just using it as an example.
Okay, thank you very much. I'm sure when I was presenting, I mentioned some of the ways that we got into this. I first of all said that capacity building sometimes when you're developing is being triggered by something. So in the design of our programs, of the capacity development program, we had already done a research. Like we implemented this project last year, one activity of the project was a research on the barriers faced by adolescent girls and young women in accessing HIV services. In the course of that research, we came across a series of barriers, including those class of marginalized groups that I mentioned that we considered equity for. So we looked into the results of the research that we had last year, and we found out that it was necessary to bring these different groups of persons, because these different groups of persons are vulnerable to HIV, and they are more vulnerable to HIV and AIDS. For example, the women with disability, sometimes they are sexually abused because they don't have power to resist. And adolescent girls and young women are also vulnerable. And sometimes they get into this sexual acts not according to their will, but because they are being forced to, or because there are other factors that are motivating that, like some go in for exchange of money in order to better their life. So we came into this kind of consideration for this group of vulnerable persons or marginalized persons. The basis was on evidence that we got from the field. And now, because we got all the evidences, we did not design the program on our own. We decided to get some key stakeholders, like we decided to involve the delegate of the health delegate of Yaoundé 3, and then we presented and said, well, this is how we want to do, this is the evidence that we have got, so we need to bring in this, and they gave their own contribution, and I think that is how we went about it. I don't know if I've answered your question well, but if I've not answered your question well, it's like maybe I did understand, but I don't know if I've answered the right question.
I think you did a great job. If I can just summarize, and I was in a intersectionality methods workshop yesterday, and this really, what you said just chimes very well with it, and that is the importance of doing research as part of your initial design. That designing in an equitable way starts by a series of steps done together, but you've mentioned a lot of them. So it's about doing the research, but we know that most research is equity blind. Too much research is gender blind. We're not even close to meeting Beijing goals on sex disaggregation. If we see it, then there's no age disaggregation, and so it's very limited. So research alone only gets you so far. So key to what you said, Evelyne, was you went out and talked to key stakeholders.
Beryl,
No,
I
Beryl,
think
Yeah, okay.
Beryl, I think we can't hear you.
Yeah, sorry, I thought I had unmuted. Just very quickly, you answered it perfectly, and some key takeaways are to design with more equitably, it starts with doing your research, but keeping in mind that research itself, to get that evidence, that research evidence, there are lots of gaps around equity and gender equality. There are lots of things that we're still not doing well enough. And so what was also important was that you consulted with stakeholders, that you were participatory at the design stage. So for us to work more equitably, it has to start right from the very beginning. And so I think those were key insights that you reiterated. I'd like to, we're going to move on to the manifesto questions, 2 questions in a moment, but Patrick, I'd like to ask you about the Barometer tool, which we've talked about less. And yet my question there is, in what ways have you ensured that that tool works with an equity lens? And I think the tool is great. It sounds fun, and it's always good to engage people, you know, the scoring system and all that. But what I struggle with in capacity development to use evidence is how I may read evidence and see with an equity lens on it and see what's missing or what's, you know, why something has been construed the way it is, or the methods, the failure of the methods to address it and things. But my users have no idea. They're just blind. Okay, so how do you build that in with the Barometer? Just some quick insights on how you're making sure that part of capacity development is to have a gender lens that's on all the time, like glasses you have to wear all the time.
Yes.
And then secondly, I don't want to lose the moment to make a call for identifying what is this barrier to getting funding for Africa-led, Africa-generated ways of working that are different from what the donors are used to funding, because that to me is a central disconnect that we have. So those 2 things, and then with the time left, we'll move to the manifesto.
Okay, so thank you very much. So the first thing is that within the evidence barometer, there are three key areas where we ensure that the equity lens is used. The first one is equity, and equity in essence tries to check all the boxes for the Progress Plus, and this has to do with things that would naturally make people will make people have unfair access to certain things that they did not decide. For example, being a woman, or coming from a poor background, or your religion, and all of that. So within the equity, we try to check with the policies to see if all of those have been considered. And then we also have the stakeholder engagement, which is one of the recommendations that would come up for the policies if it was short in that policy, which will ask the policymakers to actually engage all stakeholders in the topic. They sit down in a round table, and we actually insist to them that we want to see them sitting down in the villages to talk about what are the important things to bring on board the policy. And then the final one is the resource use. The resource use is the expectation of how the money for this program or this policy will be spread out. We insist that it must be disaggregated by gender. So that's how we ensure that that is covered within the evidence barometer. And to your second question on the challenges with getting funding, I think you would also agree with me that based on the fact that these are new things that we are developing, or we are trying to evolve traditional methods into contemporary programs and policies, this may not resonate with most funders. Now, someone may also ask that why doesn't the government, because these are the questions we've heard before, why doesn't the government invest in that? We are still trying to actually introduce this to the government. So the government needs research evidence, like in piloting, to show them that, okay, this is what you should invest in. And unfortunately, we do not have strong research funding in LMICs. So we would always depend on global health funds or other funding for innovations. But unfortunately, coming from an African perspective, the first thing is that it may not resonate with the peer reviewers of the funding. That is number one. But also number two, generally going in for funding, if, for example, eBase is going in for funding with University of McMaster, for example, you would agree with me that the ground will not be fair. University of McMaster is coming with a lot of backgrounds of hundreds of years of experience in managing funding and things like that. And we are coming with just about a decade of experience. So that is always making sure that the playground is not really level for everyone. So these are the main challenges that we have. So networking and increasing our publications is actually what we are looking out for to be able to help us through. Thank you.
Thanks, Patrick. I'm just going to piggyback on that and say that donors have to reflect on the fact that for them it's an ingrained and fairly racist lack of trust, if I may speak bluntly. And secondly, it's a fear of failing. We hang on to things that we know don't work because they're acceptable, they're mainstream. Nobody wants to be the first one to chuck them out because that's what brings the money in. So the bad stuff stays because that's what gets funded, and it's a fear of trying and failing. So let's try more, fail more, learn better in that. Now, participants, I'd like, this is for our presenters, but also the audience, and who there haven't been any questions, and we still welcome them. But there are 2 questions here at the end, and presenters jump in as you want to answer them. But essentially, we've had this discussion as part of a series about innovating and strengthening EIDM capacity development that's Africa born, bred, and led. Born, bred, and led. That sounds like a marketing phrase to me. That what is it that we've heard today and shared today that is important to make sure that is captured as well as we can and as well as we want to within the manifesto, okay? And so into the manifesto, and if you all say, if everybody here says, manifesto's fine, let's not spend our life wordsmithing the manifesto, Beryl, it's good, that's fine. But this is a seminar series. It's going to be going on for months, and it really is a collective, collaborative effort. So out of what you've heard today, what are some things that you want to make sure that we keep in mind and are building into the capacity development series? Because it can only be a series if it is cumulative and not siloed into separate topics, separate people, separate timing. So those 2 questions. Yes, thanks Ceciwe and AEN for ideally we'd have them on the same slide. Just for those, just to keep it simple, just change at the end in the manifesto, or consider, instead of consider changing in the manifesto, say consider important to include and keep in mind in other capacity development seminars. What would you make sure? We're weaving a fabric here in this series. What is important to weave into that fabric as we go along? Presenters, jump in as you want to, and anyone, I haven't got the chat up, but Precious, is there anyone offering ideas in the chat? Not yet.
So if I may jump in here, sorry. The first thing I would say is the manifesto actually builds around stakeholder engagement, which is something which is close to the heart of most at eBase. And I think this is something that we have to build a little bit more. Stakeholder engagement is particularly very relevant in the African context because we need to take a more proactive approach if we want to ensure that equity is happening. Unlike maybe in the North, where democratic systems, checks and balances ensures that there is an extent of equity happening in our context. If we do not actively engage the stakeholders and let them have their voices, going to them where they are and letting them contribute to what we are doing, to our modules, to what are their needs, to setting priorities, this will be hard to happen. So that's what I would say. I think Beryl, you are muted. Beryl, you are muted.
Okay, sorry about that. Clotilda, I see that your mic is active. Would you like to give some quick reactions?
Yes. I would like to say that when I look through the manifesto, I realize it's a great document and it's worth contributing to. But one thing I noticed is that the NGOs have not been intentionally factored into it. And looking at the challenges we have, at the level of building the capacities of many other organizations, so that there can be an increase in the number of organizations that are working to support evidence-informed decision making in Africa. I think that it is worth including. I mean, in a very intentional way, because NGOs, as we can say in Africa, actually step in to do a lot of what the policies makers and the government is supposed to be doing, but they lack these capacities. So if we really want to promote evidence-informed decision making in the work that we do, we need to build the capacities of the people who are really working towards this. And then I also want to think that there is an approach that I also noticed, that there's another form of research that is not really, how do I say it, not officially carried out, like designing a questionnaire, but just engaging the grassroots women. So I'm coming from the point of view of talking about supporting Patrick in the idea of funding. I want to say that funding for women and girls who have already been identified as vulnerable people in the community should be flexible. So for organizations that are working with these groups of people, flexible funding and multi-year funding can also ensure sustainability and therefore better results as far as evidence-informed decision making is concerned. When I look at my community peace clubs, and I look at the interactions we have been having, the training was actually, or the project has been on increasing awareness on UN Security Council Resolution 1325. And in the course of raising this awareness, we are actually examining all the pillars one by one. And in looking at the pillar on participation, we have had community meetings with these women and just asking them what they understand by participation. And they saying that it is to take a decision in the home. And we are like, okay, so what are the decisions that women are involved in? They name all the decisions, and what are those that only men are involved in, and they name it. And then we say, okay, so what are those decisions that you would have loved to be part of them? And then you realize that there has been an existing conflict that is not visible, except you just bring it down in this way, because 80% of the women say they want to be part of the decisions that men make. And to me, if this is evidence, this is with what they are saying. If we want to take up this advocacy, if they are taking up the advocacy, because from their interventions, they were actually able to prove that when they are involved in taking these kinds of decisions, the situation in their families are better than only when men do that. And they extend even to the community.
Thank you, Clotilda. Those are fabulous points and very important for us to keep in mind. Excellent examples. I have the moderator's dilemma at this point of having to intervene because we're almost out of time. And yes. I just wanted, so sorry about that. Evelyne, I don't know, there's a minute left if you have comments. I don't see your mic unmuted, but if you have been waiting to make comments, about a minute, and then we will Ziwe is going to jump in and cut us all off, and so she can get her last words in on time. Over to you.
I'm here. Can I go on? Hello?
Yes, please go on.
Okay. I raised up my hand when you asked the question to Patrick, and it's like you didn't see my hand. So just in the second, I need to add something to what you were asking. on what's stopping funding. I think I want to say that the funders, just as Clotilda said, they are too strict. And there are community-based organizations that if you give them just small amounts, small funding, they are going to do great things. And we have also noticed that these big organizations that they always favor and they give them the funding, they do not even go to the grassroots like those of us or those small organizations that are working with the community directly. And I want to say that if a funder is asking a small organization for auditing report when they cannot even pay for auditing report, that is already a barrier. So I want to say that maybe this forum had some funders there. They should relax the funding requirements, and they'll find that more people will get involved, more organizations will get involved in this program of building the capacity building in evidence, so that we have better outcomes. So going now to the manifesto, I think the manifesto is quite interesting, and it has targeted most of the aspects that are key to the objectives of the manifesto. So there are just a few things that I want to talk about the manifesto. A few corrections on
Evelyne, I think we're out of time, unfortunately, and I'm very glad that you took the time to bring in the points about funding, and the idea of small grants funding is a really important one, especially for that. But Siziwe is going to come in now. We have to wrap up the session. I believe that within the program we're not allowed to run over. It would be great while Siziwe is speaking if you could quickly jot down your comments in the chat, or send them to us by email, and they hopefully can be incorporated into the notes, I think, that are being done for the session.
Okay, that's fine. I'll send by email.
Great, thank you so much. Thanks to all the presenters in this session, Siziwe and AE, and thanks also for organizing yet another amazing webinar for us.
Thank you very much, Beryl. Just to say thank you very much, everyone. Just to say the next webinar, please join us, is going to be on capacity development aimed at enabling structural changes. We were having it on the 17th of November 2021, 2 to 15 South African time. So looking forward to you joining us for that one as well. In closing this session, the recording and alongside the blog will be published, so that we can continue these engagements and discussions that we had in this session and even in the previous session, just to make sure that if people still had contributions that they wanted to share, there'll still be those engagements that will happen. So lastly, on behalf of the AEN and the AEN team, we would like to thank the moderator, the speakers, the participants, the 2 working groups, that is evidence capacities and making connections, our AEN members, our partners and EIDM leaders, for your unwavering support. We are here in this journey because of your connections, collaborations, and expertise we drew from, and we will continue to work together to make EIDM a reality. Please continue to join Africa Evidence Week celebrations as they are continuing until Friday. So thank you very much, everyone. I'm taking this time to adjourn this webinar. Thank you so much for joining us this afternoon. Thank you, everyone. Thank you.
Bye, everyone.